Hello and welcome to Massage Science. My name is Brandon Cope, and today we're going to do a brief overview of hyperlordosis. Now, hyperlordosis is an overdeveloped lumbar curve. Now, the lumbar curve is the part of the spine in your lower back, the very bottom of the spine. And it has a natural curve to it, which we call the lordotic curve, or in this case, we could say lordosis of the curve. Now, if this curve gets overdeveloped, there's too much of that curve, it can start to lead to problems. Usually, what will cause this curve to occur for people are conditions like obesity, disc disease, and most importantly, muscle imbalances, which for us as massage therapists, we have frequently called lower crossed syndrome, as it was coined years ago back by Vladimir Yanda. And this denotes a muscle imbalance where people will have shortened hip flexors in the front and shortened spinal extensors in the back. And then on the flip side, you'll also have lengthened abdominal muscles and usually lengthened gluteal and hamstring muscles. That hip and spine imbalance together works to actually tilt the pelvis into an anterior tilt and to accentuate the curve of the lumbar spine, leading to hyperlordosis. When people have this condition, it usually causes a lot of lower back pain. And this is one of the main causes people can have of their lower back pain that we see in our society today. It'll usually also lead to a lack of strength in the muscles and a lack of range of motion. People can't bend forward to touch their toes, or they can't bend backwards as well with this condition. Usually, the typical treatments that people might explore are things like exercise. Just going to the gym, going on walks, exercising more, maybe seeing the physical therapist if it gets really extreme. They might even try to pursue other options, taking painkillers, seeing a chiropractor, maybe some surgical treatments if it seems really extreme. For us as massage therapists, if we're working on somebody with hyperlordosis, one of the first things we want to do is rule out other conditions, primarily conditions with their organs. This could be a kidney condition, maybe something like a diverticulosis in the colon in the front, especially if we're going to try to release their hip flexors. We want to make sure that it's just purely a mechanical issue with their spine and their muscles, and it's not something more serious that we need to bring them into the doctor for. If you have any suspicions of something that would be more serious, definitely have them go get a referral to their physician first, have them get diagnosed before they come back and see you, okay? If we do feel confident and we know that it's going to be something more related to a muscle imbalance, then that lower cross syndrome, usually the treatment protocol we'd want to follow is something where we would use release techniques on the lumbar extensors. So this would be like the quadratus lumborum, the erector spinae, those paraspinal muscles that are usually very short. And we'd want to be releasing the hip flexors like the psoas, the iliacus, the rectus femoris, and the tensor fasciae lata. Those are usually the primary muscles we'd be looking to release. And the types of release techniques we'd want to do would be muscle energy techniques like contract, relax. We might want to do passive stretching. We might want to do Swedish techniques or deep tissue. We might get into trigger points if we find any, okay? Those are usually the release techniques we're looking for. And then we might want to stimulate the abdominal muscles or the glutes. Usually faster techniques, tapotement techniques, cold applications help to stimulate muscles so that we can try to correct this imbalance of the hips. Okay, I hope that was helpful, just that quick overview of the hyperlordosis. Definitely subscribe, like, let me know if you have any experiences working with people and what you've learned with this condition, and I hope that you enjoyed this and it was helpful. Thanks everyone for watching.